I think the research that's been done in the UK indicated that of the 5 million children they've had a total of 6 deaths, I think, in total, and 5 of them were in children that had previously quite severe underlying conditions. The chances of therefore having a really bad outcome is less than it's around 1 in a million. Your chances of getting knocked down on the road is higher. Your chances of going out to sea and having a misadventure are higher. And people are going to the beach. People are crossing roads all the time. It's about how we manage risk. So I would say, in concert with the chief medical officers of the 4 home countries, get your children to school. I'm sure as parents you are desperate to get their education started again. I'm sure the children are desperate to learn again. I think their social groups, I'm advising Department of Education at the moment around what protocols they need to put in place, but generally my view is their social well-being will have a consequence for them for the whole of their lives, 70 plus years, and that will be far longer and more sustained than the fear from COVID. So I don't want to have anxious adults growing up. So yes, there are protocols in place. Children will be safe. Yes, we will have some outbreaks in school, but again, nothing to worry. The harm that arises from children is very minimal. I'm more vexed actually about the transfer to their great-grandparents and their grandparents. We really need to protect that group if we can.
So you said that protocols are in place, but they haven't been communicated to the public yet. Parents don't know yet what the school environment is going to be like, who might wear masks and all the rest of it.
So I'm busily trying to sign off those protocols. They're actually in my entry. We've had a number of conversations. I've been to meetings, and we've agreed on certain principles. So I'm just signing them off in terms of the detail at the moment. In terms of mask wearing, I don't think it's necessarily appropriate. I take the view that all our pupils shouldn't wear masks. I think that inhibits their behaviours and their social interactions. And as I've said, social well-being is as important, if not more important at this time, than the potential risk of getting a cold, which is all that will happen with a child currently. So masks won't need to be worn. I'm trying to address the thing around social space and protection for teachers. There's all sorts of discussions about air conditioning, ventilation of the rooms, how I get asked all kinds of arcane questions and I have to go through them bit by bit. So if I can assure your viewers, schools, determined that schools will open, it's good for the kids, it's good for the parents, and actually the harm from COVID has made us feel that the whole world around us is risky. It isn't. We deal with risk every single day. As soon as we get into an aeroplane, as soon as we get into a car, sending our kids to school is no more risky, in fact less riskier than either of those activities.